Hello, welcome to lesson number 5. In lesson number 5, we introduce the concept of intervention, and we discuss a really big picture overview of treatment, and finally a discussion of the detox process, or another small introduction to detox. This is a really good chapter in terms of readings and the supplemental material I provided. There are supplemental materials from the HBO videos again, and from federal resources related to the detox process, and a really good document titled Effective Principles of Intervention or Treatment that you will find as a PDF. This is a great document that you may want to keep, hold your hands on it, print it out, those type of things. These principles provide a great overview of why we believe that addiction is a disease and how we should intervene and what does include quality treatment. I also include material from the ASAM group, the American Society of Addiction Medicine. These are the actual medical doctors who are board certified in addictions, medical doctors who actually understand the addictive process and what good treatment is, and that addiction is a disease. And honestly, it's difficult to find these folks. There's a shortage. But if my family member is suffering from addiction, especially one who has a dual diagnosis of addiction and another mental illness, my first stop during the process would be to see a ASAM certified physician. Again, I'm giving you an opportunity as well to try to search out via the ASAM website the closest physician to your location as part of the activities. Before we do move on, we can talk about the intervention process. As the book states, and as I always tell my classes, what we see on TV, in popular media, in reality TV, in terms of the intervention process of folks sitting around the table and 5 or 6 people, the family members and clergy and everyone in between, intervening with the loved one who is in the throes of addiction. That's not what interventions are, to be honest. They seldom happen that way. And to be honest, those TV shows totally rub me badly. I see it as a breach of ethics to portray those individuals on TV, and it does no good. And we're basically voyeurs to the substance abuse process in our living rooms when we watch these TV shows, because it's not reality. It's not how life is. And we are victimizing the client, the addict, more than we're helping them. And we're damaging the treatment process. So I'm not a real big fan of intervention shows or treatment shows that's on TV or movies or those type of things. It's a very damaging process. That's the first chapter reading. Your next chapter discusses why it's so difficult to obtain treatment, and it is extremely difficult to obtain treatment, especially in smaller regions such as Southwest Virginia and this part of the South. Even with insurance, it's difficult to receive quality treatment. Without insurance, it's just as hard. Treatment is an expensive opportunity that many folks cannot afford, and too many families invest life savings or go into significant debt to give family members an opportunity at treatment, and they're not told the entire story about the treatment process. That one inpatient stay will not solve the problem, that your victim or your addict, your family member, will more than likely relapse again and will more than likely need treatment again. And family members are just not told this by treatment centers, generally speaking. And too many individuals actually attend inpatient treatment that when it's not needed. When outpatient treatment can frequently be just as successful if it's appropriately implemented with the support of the family and especially if the person is employed. Many people go to the inpatient treatment option first when I'm not sure it should be, to be honest. Last but not least is the detox process. Detox is not treatment, and your book kind of says detox is primary treatment, but I have a hard time with that justification in most settings. There's some debate in the field. A detox is basically cleansing the person's body, the addict's body, of their substance. A good detox protocol lasts 5 to 7 days, maybe longer, is frequently assisted with medication, and certainly under the supervision of physicians. Detox frequently happens in the hospital setting, in a traditional hospital, or can happen in terms of partial hospitalization. This means inside of a inpatient facility that has a clinic and a doctor on staff and nurses, but are really not. It's really not a hospital though. It's more or less a medical clinic. And there are old ways to detox individuals that, of course, is never recommended, which is a long-term alcoholic goes to the local doctor or AA meeting. He cannot afford detox, and he's told, well, Tim, since you can't afford detox, drink 2 beers less today than you drank yesterday. Then drink 6 tomorrow instead of 7 today. Then 5 the next day. Then 4 the next day. And it's basically, as your book calls it, white knuckling it, or self-detox, which is very, very dangerous for most patients and needs to be avoided. Um, as the book says, detox is frequently paid for by insurance companies, but the old way of doing things was to pay for detox for 3 or 4 days, then send the person back home, as if that was going to improve anyone's circumstance, and it doesn't. It may actually make the circumstance worse, in all honesty. So this is a big chapter with lots of material that we'll be covering. Please take an opportunity to look at the information being presented, spend some time and do some hard work with your discussion board for this lesson, and I look forward to hearing from everybody. Take care.